Hi, I'm Jae Corman, and I lead research at FOLX Health. We recently published a paper called Mental Health Changes in U.S. Transgender Adults Beginning Hormone Therapy via Telehealth in JMIR. Transgender people often face significant mental health challenges due to systematic discrimination and lack of access to medical care. Gender-affirming healthcare, otherwise known as GAHT, including testosterone and estrogen for many individuals, can be very important in improving the mental health of trans adults. However, many trans adults face a lot of barriers in getting that care, including lack of geographic access to that care and inability to find the right doctors that can provide them care. But luckily, in recent years, telehealth has expanded access to primary care, including GAHT, for many individuals. Much of the research that looks at the effects of GAHT on mental health has happened more than 4 or 5 years ago and doesn't often include people who are initiating via telehealth. In addition, many studies only focus on one geographic area, such as an academic medical center. Our paper comes in because we provide data from people across all of the United States, all initiating gender-affirming healthcare at the same time via telehealth. We enrolled people from FOLX Health, a telehealth provider for the LGBTQ community that exists across all 50 states, and we enrolled them in the study and looked at changes in depression, anxiety, and suicide ideation over the course of a 3-month period. People came to us with significant mental health challenges, including about 40% of people had depression before they came into FOLX. What we found is that 40% of people who started with depression and anxiety saw their symptoms cut in half. And among those who had thoughts of suicide ideation, 60% no longer had them at the end of this study. We also saw some differences in people who had received mental health treatment versus people who hadn't had mental health treatment, which was another added benefit of this study that often overlooks the additional benefits of that. We were actually very surprised to see such large improvements in mental health. These are larger than have been seen in other studies, and in fact are larger than what we see when people take things like antidepressants or do cognitive behavioral therapy. Although GAHT is not specifically prescribed as a mental health treatment, it's prescribed for something totally different. These benefits are incredibly large and really highlight that telehealth is an important modality for delivering gender-affirming hormones, and particularly can have large benefits across different types of folks, across different geographies, across different ethnicities and races, and across people who both receive estrogen and testosterone therapy. This has some promising effects of telehealth for gender-affirming care. We chose to submit our research to JMIR because it's the leading journal for digital health research, and it has a high impact factor, which was very important in my decision to publish. In addition, it will be published alongside other interventions about digital health. And finally, they have a focus on health equity, which was important in publishing in this journal.